Okay, so the topic was on cancer and breast cancer to be specific. One second. Okay, so cancer is a genetic disease in which there's an uncontrollable growth and spread of abnormal or damaged cells. These uncontrollable cells, is caused by mutations that are inherited or acquired in genes. Malignant tumors, another word for cancerous tumors are called malignant tumors. Um, these uh, these instruct normal cells to allow rapid growth, inhibit apoptosis, and render DNA repair genes useless in repairing mutations. Uh, these examples of these acquired mutations are carcinogens, radiation, smoking, and hormones. There are many other factors. Um, there are there's approximately 200 types of cancers. However, there's a general category based on the functions and location of the cancer. So the breast cancer is found in carcinoma. Sorry, I'm a little bit nervous. All right. There are two types of the breast cancer can occur in the ducts and the in the lobules. As you can see in the figure, the lobules, the the um, the ducts has two cancer. You can have invasive cancers and non-invasive cancers. Invasive cancers spreads through surrounding tissues and organs, and non-invasive cancers can only be found in the ducts or the lobules. Sorry. Uh, Breast cancer is subdivided into the gene HER2 and the hormone receptor positive and triple negative. The hormone receptor positive is a cancer that expresses either the estrogen or progesterone receptors in cells. These receptors are used for cell growth, so the cancer needs this in order to survive. HER gene similarly also aid for cell growth. This produces the protein HER2. However, HER2 can also be found with hormone receptor positive cancer, but triple negative cancer cannot be found with either the HER2 genes or the hormone receptor positive. This cancer is mostly found in Black women and Hispanic women, and these woman has to possess a mutation in the BRCA1 gene. The incidence of breast cancer, according to the WHO, more than 2.3 million women were diagnosed in 2020, whilst 685,000 deaths were recorded. In 2012, it represented more than 12% of all new cancer cases, and now it represents more than 20% globally. Globally, it now represents 1 in 4 of all cancers in women. The highest incidence of breast cancer was found in Belgium, with 112.3 per 100,000 in population, and the lowest incidence was found in Iran, with 35.8 per 100,000 population. Breast cancer is the most common cancer in women. It has surpassed lung cancer, which has been leading for the past many years. Since 2020, it has surpassed lung cancer, and it became the most commonly diagnosed cancer amongst women. The average peak age recorded in Asian and African countries were approximately 10 years old, which is much earlier in comparison to European countries. According to the figure above, the incidence rates are much higher for women above the ages of 40, which may theorize that menopause could be a factor contributing to the increased incidence. The incidence varies in different countries. It is found to be higher in high-income countries compared to low-income countries. The incidence rate of breast cancer in developed countries is approximately 88% higher than developing countries. In transition countries, breast cancer represents 55.99 per 100,000 population. In transitioning countries, it represents 29.7 per 100,000 population. The highest incidence rate for 2020 was more than 80 per 100,000 population in high-income countries, such as Australia, New Zealand, North America, Europe, and Belgium, recording the highest incidence globally. The lowest incidence rates were less than 40 per 100,000 population in low-income countries such as Africa and Asia. The mortality rates, however, are vice versa in comparison. These rates are mainly due to the fact that high-income countries has the means to support treatment for breast cancer, and they are able to diagnose cancer faster than low-income countries. Low-income countries cannot. They mostly diagnose cancer during the last few stages, and that's when it is more costly to cure cancer.